Hi, this is Stephen, and in this video we will discuss the basics of an echocardiographic stress test, specifically looking for ischemia. In a previous video we talked about how from apical 4-chamber, 2-chamber, and 3-chamber we can actually figure out how each of the segments of the heart are moving, and we can map that out to see if it fits with a coronary distribution. Let's take that concept a little further in this video. Just by way of reminder, if you have normal function, that normal wall thickening and movement, that gets a score of 1. If we have hypokinesis, that gets a score of 2. If we have akinesis, that gets a score of 3. If we have dyskinesis, that gets a score of 4. And if we have aneurysmal dyskinesis, we have aneurysmal movement, that gets a score of 5. And so how do we do an echocardiographic stress test? Well, basically, there's a couple different ways you can stress the patient. One way is to have them ride on a bicycle. You could have them exercise on a treadmill, or you could give them dobutamine. With dobutamine, you'll gradually increase 10 to 20 to 30 to 40, increasing every few minutes until the patient reaches a target heart rate, or if there are wall motion abnormalities, so you stop with reaching the target heart rate or with wall motion abnormalities, or if the patient has symptoms, of course, where they need to stop. But once you reach the heart rate, unlike a treadmill EKG test, the clear distinction. There you keep going even past the target heart rate. Here you would stop based on the target heart rate. So, okay, so we stress the patient, whether it's with treadmill, with cycle, or dobutamine. And what are we looking for? Well, a normal response would be that all of the segments start off as a 1, and they increase. They're hyperkinetic. That would be a normal response. What would be a response concerning for ischemia? Well, if you have normal function initially, that over time, that with stress becomes hypokinetic, or if you have a hypokinetic area that then becomes akinetic, these are concerning for ischemia. Why are things getting worse? We don't like to see things get worse with stress. It should get better with stress. Now, what if we see that it is not moving much before or after? Or what if we see that it is akinetic before stress or with stress? This is something that's already dead, an infarction. Dead tissue will not get better with stress. However, if you see that it is not moving but then starts to move better, or hypokinetic to normal, that may be viable. It's not normal tissue. Normal tissue should move well and even better with stress, but if you see that certain segments in a coronary territory are not moving well, but with dobutamine are moving better, that could reflect that those parts of muscle are that those sections of the muscle are viable.